Thank you very much for inviting me to speak today, and I'd like to thank Aunty Di for welcoming us so warmly today to Wurundjeri country and pay my respects to elders past and present. And I'd also like to thank the Luicha Institute for hosting us here today. I spent many years in this building in my years working for the Cancer Council Victoria, and I can tell you that you've done a fantastic job in renovating it, because it certainly wasn't quite as spiffy as this building is now. I'd also like to acknowledge a couple of colleagues from breast screen programs across Australia here today who are also in attendance. I'm here to speak about the National Breast Cancer Screening Program. I actually work in the Department of Health Victoria, so am responsible for overseeing the implementation of the screening programs here in the state of Victoria. Okay. Before I start, I guess I would like to say that whilst great gains have been made in the area of breast cancer for women universally, I'd like to acknowledge that these gains have not been equally shared across certain population groups, and that Aboriginal women continue to be greatly affected by breast cancer. And that is of great concern, I guess, to us as a program. The Breast Screen Australia program was established in 1991 and operates as a joint program between Commonwealth and state governments, state and territory governments. And it is a population-based screening program for well women to detect breast cancer early. So it's a government response, I guess, to how we can actually detect breast cancer in well women. It's administered through states and territories, and it looks slightly different in each state and territory, and the services vary in size and cover really vast geographical distances. The services are offered through a variety of means, through permanent fixed sites as well as mobile screening sites across the nation. Services vary in nature, and some are wholly set up within the public sector, and whilst others are wholly also administered through the private sector, and some services are a mix of public and private. The way in which screening operates is that an initial mammogram is performed in a screening service, and if a woman needs further investigation, she is recalled to an assessment centre where any abnormalities are assessed by a multidisciplinary team. And if screening identifies suspicious signs of cancer, further investigations are undertaken up until the point of definitive diagnosis. So a lot of people think that screening is just the initial mammogram, but actually the screening program operates up until the point of definitive diagnosis of a breast cancer. And just recently, the program expanded to include women up to the age of 74. Previously, the program was targeted at women aged 50 to 69, but just recently the Commonwealth Government announced an expansion to the program to include women up to the age of 74, which is a fabulous addition to the program. Women under the age of 40 and over the age of 75 can actually participate in the program but aren't actively invited to attend. And ways in which we get women to participate in the program is really up to the states to implement. So the strategies to encourage participation are very localised. They're actually generated at a local level, and so those recruitment or participation strategies are quite specific to each state and territory. We've heard a lot this morning about data and the incidence of breast cancer in Indigenous women. So according to the Australian Institute of Health and Welfare, briefly, we know that Aboriginal and Torres Strait Islander women are 20% less likely to be diagnosed with breast cancer, 30% less likely to be hospitalised for breast cancer, and 1.3 times more likely to die from breast cancer. So we know that the outcomes are much poorer for Aboriginal and Torres Strait Islander women, and therefore we see that there's a real moral imperative for us to address this inequity within the system. In terms of screening participation within the breast screen program, In 2010-11, 36% of 36% of Aboriginal and Torres Strait Islander women participated in the program, compared with 54% in non-Indigenous women. So we know that there's a very big disparity within the program, and something that we all need to address at a systems level. Some of the challenges that we recognise within the program is that, and some of these barriers to participation in cancer screening include lack of cultural safety within mainstream services and related medical distrust, the use of one-size-fits-all service system models, stress and social isolation, socioeconomic disadvantage, and complex comorbidities, and the feelings and existence of shame connected with breast cancer. And we heard Annie Dye speak about that very briefly this morning in her welcome. So I think there are some things that we do know, and I think there are increasing efforts to address the system level barriers to participation, but obviously much more needs to be done. The challenge for us within the screening programs really is about ensuring both equity of access to screening services and equity of health outcomes. And it's critical to the core business, not just of the screening services who deliver the services on the ground and their work with communities, but it's also critically important for us as policymakers and government when setting priorities. And the only way we see of being able to achieve this is through partnership with community and drawing on the leadership and knowledge from within the community in order to be able to make those changes. So, thank you.